Hi everyone, it's Dr. Sarah here. So I've just done my first day of telephone consulting, and yeah, it was good. It was effective, and I think we still managed to get quite a lot achieved. So I had to do that because I'm a bit sick, and now when we are unwell, we have the capacity because of this coronavirus to actually work from home and use item codes through Medicare, and thankfully we can actually bulk bill you for that. So there are some pretty dramatic changes that I'm bringing into Claremont Country Practice, and these changes are to protect you. And I want to just take the time to run through those with you so that you understand what's going to be happening over the next couple of weeks if you need healthcare. Now, I am making these changes for you guys because I desperately want to limit the spread of this virus in our community, and I see this as the best way to do that. Yes, they're aggressive measures. Yes, they're drastic steps to take, and they are painful. They're painful for all of us. I don't particularly want to be doing it. It is costing our business, but at the end of the day, all of that needs to come secondary to public safety, and that's what this is all about. So, bear with me. Again, I'll go through this with you. So if you think about a GP practice waiting room, you really have a whole heap of sick people mixed in with a whole heap of vulnerable, high-risk people. And my theory, along with many, many other GP practices around the country, is that if we can separate those two groups and pretty well move into a model that keeps these two groups away from each other, especially in the practice setting, we can protect you guys from the spread of the virus, more spread of the virus, and less cases will equate to less deaths. So we're going to change to basically a remote clinic, and that is quite simply to keep people out of a highly contaminated waiting room. You can imagine that if this thing is aerosol spread and it sits on a surface for up to 9 hours, no matter how much cleaning and disinfecting we do, there will be bacteria amongst viral particles everywhere. And ultimately, our waiting room will just become the local hotspot for this virus to spread. So, apart from protecting you guys, we also want to protect ourselves and prevent the need to close a practice for anywhere from 2 to 4 weeks. As a result, we are moving to a strategy of using the phone to manage all of our consults. And from these phone consults, we will decide, do we need to go on and do a telehealth consult, or do we need that person to come in and see us face to face? So today, I saw someone that had a wound, actually a few wounds, and I was able to use FaceTime to have a closer look at that wound and say, yes, it needed antibiotics, no, it didn't, or it needed another form of treatment. So it worked really, really well today, and I didn't need to activate that with a whole heap of appointments. I only needed it for a few. So phone consults, it's really, really important we have the correct number. It's important that you're available. Sometimes there are technical difficulties and I'm going straight through to message bank, or I'm having trouble getting through, or the person is on the phone. If that happens, don't fret. We will keep trying you, but we may need to move on to the next consult if we are unable to get through to you until you answer the phone. We will be sending text message prompts, and at the time of your phone consult, we'll make the decision about when and if you need to come into practice. Telehealth consults, I think I've kind of run through this already. There's a whole heap of different mediums that we can use. It does involve a little bit more technical skill and does present some other barriers. So we will get this up and running as quickly and effectively as we can once we find out some of the problems. Face-to-face consults. I'm trying to keep these to a minimum because I'm trying to reduce the amount of viral load that we may come into contact with as individuals and staff. So essentially, I'm separating them into two groups. The high risk group, which we've gone through in various other presentations before, will be seen early in the day. We're not going to have a waiting room, so we're going to ask you to arrive in your car, stay in your car, and call us from your car so that we can collect you and take you directly to an alternative examination site that is not actually in the clinic. It's a room that is beside the clinic, but not in the clinic. And this site has been designed to protect our high risk individuals from essentially contamination with the virus. So we've got a room, it's very well ventilated, there's very little furniture in it, and every surface is easily cleaned. We're providing this service with great difficulty for your safety. So it's not very pretty, but it certainly is going to do the job and hopefully achieve a good outcome. The low risk face to face consults essentially are those people that need vaccinations. They might be procedures like ECGs. It could be any number of things that we essentially can't do on the phone or face to face. It might be an urgent blood test. So, again, pretty much the same as with the high risk. There won't be a waiting room. We ask you to arrive, stay in your car, give us a call, and we will come and collect you as we're able to. And we'll walk you straight into the clinic, and then when we're finished, straight out. So essentially, this will be compensated largely by Medicare. We've made the decision to bulk bill as much as we can, and that's because we understand that this situation will put financial pressure on the community, and there will be a lot of people on sick leave or unpaid leave, and this will have a fairly negative flow-on effect financially for individuals and businesses. Apart from that, the government has created certain barriers around billing in different circumstances. So this is our billing structure. If I'm unwell, like I have been today, or Krishna for that matter, I can still work from home. And because I'm unwell, all of my consults essentially can be bulk billed. Obviously, I just can't see face to face. If I'm not unwell and I'm at work, I can bulk bill those that are high risk via phone and telehealth, but those that are low risk, there is no actual Medicare rebate for me to be able to bulk bill it. So that means that there is no way for us to be compensated for that service other than by charging some form of fee. So the face-to-face consults in this group, at this stage, we're applying normal rates. And this is because they do expose us to a degree of risk and illness. And it's been quite difficult for us to coordinate a way to structure these appointments that is still safe for you and safe for us. Aside from the structure that I've gone through with you, we will no longer be collecting bloods unless it is quite urgent, and in which case we will go through a screening process for those people that do need bloods. And the main reason for this is it's quite difficult with so many people coming and going, coordinating phone consults to be able to screen every single person that comes in. And essentially, we really should be wearing PPE to take bloods. So we've got gloves, we don't have enough masks, and we certainly don't have access to gowns. So if someone is sick and needing bloods, this will really pose a high risk to either myself or my staff. So we'll let you know a little bit more about this as we've got more information, but at this stage, unfortunately, we are unable to continue this service. Now, I know this is aggressive. I know these changes have been pretty full on, but they're really being put in place to protect you, and I need you guys to bear with us. These changes do come at a substantial cost to this business and its staff, and so we really need your patience and understanding, because I'm not doing it for us. Face-to-face consults are far more easier. It's it's you guys, it's preventing death, it's preventing unnecessary virus spread. That's really what this is about. I'm fully aware that these changes will impact the ability for us to provide all of our normal services, but at the end of the day, it's really not about non-urgent health issues right now. It's about keeping the public safe. As this situation evolves, if we are unable to control the spread and the economy really does get affected, we are likely to review our fee structure. So that's it from me. I think that pretty well covers everything that I needed to tell you. I'm told it was pretty much chaos at the clinic today. I'm sorry, I didn't get this out in time, and yeah, I've done my best, but probably haven't quite communicated to everybody as well as I needed to. So I apologise. Yeah, uh, look, do everything you can to stay healthy and stay well. And if you're concerned, book a phone consult, please. Otherwise, yeah, wash your hands, social distancing, stay at home if you're sick. You know all the rules. Thanks very much. Bye.